so that that lady can be helped from this?
So when it comes to this particular problem, it depends on the diagnosis, why exactly it is happening. So in some cases, it is ectopic pregnancy, where the pregnancy is not actually a pregnancy that usually seems like a pregnancy, and then it is terminated because the child is not actually growing where it should. Okay, so it either could be that issue, or it could be yes, like abortive tendency. So in some cases, homocysteine plays an important role in understanding the fertility of an individual. In that case, the pregnancy actually does not happen only, because in that case, if the infertility happens, then a supplementation with methylfolate and vitamin B6 is done at a higher dosage, and there are research papers that prove it, where homocysteine elevation, it does lead to infertility. So that is one of the phenotypes. Neural tube defects is when the baby is affected in the fetus condition in the mother's womb. So that is one of the phenotypes. But as far as this miscarriages you're saying, the tendency of miscarriages for the mother, that may not be genetic, because in some cases kya hota hai, the parents have had a good tendency of bearing children, but it is more to do with the constitution of the mother. Because kya hota hai na, most of the times nowadays I'm seeing, and it's not something that is bad, but a lot of mothers, they themselves are busy so much with whether it is their work or whether it is the stresses, it does put an effect. It does affects the pregnancy in a way. Also, there is an important part that needs to be taken care of, is the antenatal care. Antenatal care is usually the vitamins that are given during pregnancy. Now, if the mother herself is deficient in some vitamins and she hasn't got an entire screening done before, if she can't sustain, like in the pregnancy chapter, you remember I said something like, if she cannot provide for her own body, she can never provide for the child that is growing inside of her. So if suppose the mother is already deficient in certain important vitamins like B12 and B9, and she's not able to provide it for the child, the child's spinal health will not grow. If the spine doesn't grow or the brain is not supported, the chances are that the child would be stillborn, or there would be certain neural tube defects with the child, right? Just like the genetic test that is done. So I would think it is more to do with the mother's constitution, or it needs to be looked into, where the reproductive screening needs to be done, the reproductive organ screening needs to be done to understand why exactly it is happening. But genetically, it's not hereditary, so it may or may not show there. Okay.
Thank you, Rita.
Okay. All right, now moving on to the next chapter, we will just a minute. Okay. Yeah, so I'll just take you through the sample report. So this is how the sample report looks like. Okay, so here you must have seen there's the client profile, so where you have the height and the weight of the person. Then there is a welcome letter. There are certain authenticity certificates that are given in the beginning just to understand. Then whatever you have studied in the chapters, just to give a brief in to the client who basically has a report. So they may or may not know much about genetics first. So this is something basic that they need to understand what exactly a genetic report is about. And these four are the main indicators that becomes easy for a person to understand the summary. Because पूरा report अंदर देखने से पहले, the first summary that comes in front of you is more easier to understand and identify. So the four key emojis are white, green, yellow, and red, where the white and the green states that you do not carry a genetic risk variant, but the green indicates advantage. In some cases, it helps in reversal. Okay, when you have yellow, it is a moderate or a medium risk, and you have high risk indicated by red. Okay, now when it comes to the first category, do you remember when we spoke of nutrient deficiency risks? Now this report, you can see that there are so many risks or predispositions to nutrition deficiencies, right? So if this person just relies on food sources and yet it is not completing, the person will end up with nutritional deficiencies over and over again until these deficiencies become a root cause of major health issues. Okay, so this is the first category that you have. Then you have second category that talks about intolerances and allergies, like we discussed gluten, lactose, and caffeine. Gluten also leading to celiac disease. Didn't we see there is a main difference between gluten intolerance and celiac disease, right? Celiac disease is a much magnified form of gluten intolerance that can actually damage your intestines, and it can be seen with colonoscopy as well and certain blood tests. Okay, when it comes to salt metabolism, salt and caffeine can be linked to blood pressure in some person. So one thing you need to remember when a genetic report is read, it is not read as हाँ आपको इस gene के लिए ऐसे करना पड़ेगा, for this you have to do this. No, it is correlated a lot with different phenotypes and the health issues. Okay, so if a person has both of these, caffeine intolerance as well as salt metabolism issues, plus the person has hypertension, so now imagine you can actually link these two to that. Either the person is taking more of caffeine in the day or salt in the day. So by modifying these things in the diet, the person can actually see the changes that happen in the blood pressure, but it's actually happening because of that, right? Then you have the dermatology section, which is your skin related section. So like I said, all of these help in understanding your predisposition to skin related disorders. Especially remember when I said vitiligo, the trigger for vitiligo here for this particular client, vitamin D as well as gluten can trigger vitiligo, which is white patches on the skin, which is destruction of skin pigment, melanin, right? So here this person can not only identify whether the risk of vitiligo is there or no. In this case, genetically, she does not carry a risk. But the problem is the deficiency of this can trigger vitiligo. Okay, so in both ways, it can be understood. Then you have weight management category where obesity risk, likelihood to overeating, sensitivity to fats and carbs, the chances of adiponectin being on the lower side could be one of the root causes for weight gain. Advantageous genes like ginger and PUFA both can help this person lose weight and easily for that matter. So here it is an advantageous gene which may or may not be there in everybody. So this person carries a reversal gene. Okay, now apart from that, MUFA, the oil that you consume at home. In this case, the person has to limit intake. See, if they're not asking to avoid, there is a limit intake here, which means it needs to be limited. In some people, Mediterranean diet that has more of omega-3s and 6s, or for that matter, MUFAs, monounsaturated fatty acids, is a Mediterranean diet. It works for some people, but Indians may majority it does not. There are people who actually show this in green, which is about 20% of people, I'll tell you. So this is also very interesting aspect of the genetic report. Then you have diabetes risk. So not only diabetes, but also in this case, if you see, this is a rare genetic type where in fiber, especially the insoluble kind, can actually cause issues if this person is already a diabetic. So what kind of fiber this person needs to have? Apart from that, if the person has a risk of diabetes related, complications like diabetic cataract, nephropathy, then you have neuropathy, tobacco and smoking, how does it affect nephropathy? So this is about the diabetic category. Then you have thyroid related. So see, this person has not only the risk of hypothyroidism, but also Hashimoto's. So not only T3, T4, TSH will need to be done, but also TPO antibodies. Because if autoimmune related hai ye, they will have to treat the autoimmune disorder, not the hypo. Hypo ho raha hai because of the autoimmune disorder, right? So herein the person can actually save a lot of time in this case. Cardiac diseases, not just your lipid profile, but also many important categories. Now see, this person doesn't have a risk of cholesterol. They have a risk of hypertriglyceridemia. They also carry an advantageous gene that can help them reverse triglycerides in 8 weeks without medicines. So by just EPA alone, which is eicosapentaenoic acid, this person can reverse triglycerides by 60% in 8 weeks. No need for medicines. But at the same time, if you see, this person has a risk of homocysteine, which puts them at a higher risk of heart attacks as well. Also atherosclerosis. coronary artery disease. So it needs to be taken care of from all the sides, not just getting a lipid profile done. In this case, the person will have to essentially get homocysteine done on an emergency basis because it is a very high risk. This tells me that this person has a very strong family history of heart disease. Okay, so this needs to be checked. Organ health, like I said, gallbladder related, whether it's bowel related, liver disease related. In this case, there is a strong history of liver disease and a predisposition at that. Cataract, hearing loss, then you have uric acid, glaucoma risk. Okay, then kidney disease, you have chronic kidney disease. This patient or this client does have a risk of CKD and a high risk at that. So there needs to be a proper care and a test done every year. Then inflammatory diseases, risk of overall inflammation, allergies, arthritis, asthma, pancreatitis, obstructive pulmonary disease. Now, pancreas is also the place that produces insulin, right? So if your pancreas are affected indirectly, the reason for type 2 diabetes could be secondary to pancreatitis as well. The neurological health, you have Parkinson's disease, Alzheimer's disease, then how in anti-inflammatory foods, flavonoids will affect this person's risk of developing it, or how they can reverse the onset. Then you have autism risk, migraines, the trigger for migraines, caffeine, alcohol, cheese. Then you have ADHD, which could happen in kids and adults as well. Then the risk of panic disorder and how to manage it, if medications even work, and in this case they don't, right? So how can it be managed? Then there is restless leg syndrome. You have septic shock, pain sensitivity, okay, vascular dementia. So eating disorders and addiction risks related to dopamine, whether there's a risk of depression and how depression can be managed. Here, the person does not have a risk of depression per se, but exercise and sleep can play an important role in preventing it, at the same time managing it. Suppose if the person ends up with depressive tendencies. Then the anxiety linked to caffeine. Okay, then the schizophrenia risk and dependence on drugs, alcohol, nicotine, etc. There are certain personality traits as well, like decision-making ability. So decision-making ability tells you if a person is more impulsive in decision-making or takes calculated risks as well. Then gender-specific risks talks about male and female, like I said, and this is a female's report. So here is a polycystic ovarian syndrome, neural tube defect in offspring. In this case, if the mother does not take care of B9, B12, and B6, the child will end up with a spinal defect. Okay. Adverse pregnancy outcomes with caffeine. A lot of women take caffeine even during pregnancy. So as per the genetics, if the person takes caffeine and they have a high risk, it leads to a low birth weight infant or a premature pregnancy. Okay, then you have spot baldness in females and males. So this gene is tested in both. The gene associated here is MTHFR. Okay, then DNA damage and biological aging, we spoke of that. Then you have drug response, like I said, if the person will be wasting more time on metformin or decides to go on pioglitazone, this will help, right? Not just the patient, but also the doctor in understanding what is the targeted method of going about. Then the fitness category is another long category, talks about the ideal exercise, at the same time what works in terms of food, in terms of supplement, in terms of managing the weight, at the same time interesting ones like cold tolerance. Now it's a very rare genotype to have a good cold tolerance here. Okay, so when it comes to avoiding inflammatory foods, risk of injuries, okay, how to manage that or how to prevent injuries is what is explained in the report or the counseling. Then associated with exercise, the chances of inflammation, okay, risk of knee injuries, exercise recovery time. So everything you get to know from this category. Then the last two being circadian rhythm, that talks about your biological clock and whether you should exercise, how you should exercise at what time, metabolism, carbohydrate intake, and your immunology, that talks about oxidative stress. Okay, so that could be on the basis of sun damage, alcohol, smoking, radiation, pollution, or your own body's detoxification method. Okay, so this is your report. how every page looks inside. I'll just show you one example. So this is how a report or in the page it looks like. The name of the test is on here up above. The emoji on the right should tell you directly whether you have a risk or not. Then on the left side, there are genes that have been analyzed for this particular test. So in some cases, there are more than 2, 3. If you see in diabetes, you will see 3 genes. Obesity, you will see 4 genes. So here the risk variant is present, which is why this particular meter shows elevated risk. Now the associated symptoms, the food sources to consume, everything is given here, right? And also the research recommendation. And finally, okay, so this is the report that only talks about the genetic aspect. But when we talk about the action plan, that is done not only on the basis of the genetic report, but also taking into consideration the person's current health issues. Okay, and that is the main reason why we give an action plan. But now, what would have been the need? The genetic report would suffice, right? It has everything in it. But now, when it comes to a client, when the genetic report is done, the genes are the same right from childhood to old age. But now if a person gets done a test at, let's say, 6-year-old, or if the person is 60, the current health issues would be much different, right? So now in the case of the nutrigenomic counselor, the counselor will not only have to look at the genetic report and make the gene-based diet, but also understand how to correlate with the current health issues. Because that correlation is not happening in your genetic report. The correlation happens in the action plan, where on the basis of the person's weight, current parameters, current requirements, and food preferences, allergies, etc., it is made. Okay, so the action plan is made on the basis of the fact that one size does not fit all. It is made on the basis of a person's medical health conditions, current medical health issues, food preferences, etc. Maybe the person has developed certain allergies that weren't even in the genetic report because of the person's lifestyle or habits. Maybe the person has certain health issue that's not showing up in genetics because it's not heredity, but the person ended up developing it because of lifestyle disorders. So how to manage this while taking care of predispositions that you have through genetics is usually taken care of in your action plan. So the action plan is taking care of not just your weight related goals, but also it helps in improving your energy levels for people who have issues with persistent fatigue, deficiencies. It helps you in managing your current health conditions, understanding if there is a root that lies in your genetics. And in some cases, your genetic report forms a foundation for even diagnosing your health issues that have gone undiagnosed. Okay, so here the sample action plan, how it looks like. And if you have any doubts, we will go through after this. Okay, so this is action plan is not long usually, unlike your genetic report, because this is concise to your current conditions. Okay, so this is the sample action plan where we first give you understanding of what exactly is nutrigenomics and what could be your benefits. Then you have your personal information that's given here. So here the primary health focus is taken into consideration. Now see, this person, this client has hypertension, type 2 diabetes, uric acid elevation, hypothyroidism, and gastric issues. Now imagine so many health issues, and the dietary guidelines for each one of them might either clash or overlap, right? So here, what would be the best diet for the person? Taking into consideration the genetics is what it's done. And in some cases, we'll try and understand how exactly are certain intolerances also, or certain genes triggering these health conditions. So when we take care of the root cause, these are only symptoms at the end of the day, right? So the things to do, the first talks about to avoid, include, and what to take in moderation. Now this also includes whether the person has intolerances, so they understand not just what to avoid, but if they have to avoid, what to take in its stead. Because people would be more bothered about what they can eat at the end of the day, not what they can avoid, right? Because you can give them a list of things to avoid, but then they'd be like, what do I eat, right? So this is most important because you see what they can include if they have to avoid this. Okay, so there's always a replacement. There is nothing that you have to avoid in terms of food groups. So here we talk about on the basis of genetic nutrient deficiency risks, what they need to take. Now they may not be deficient already, huh? So this page talks about the predispositions that they have as per their genetics, also may include what they currently are facing. So let's say the person does not have a risk of B12 deficiency, but already has developed deficiency. So we include that in this as well. At the same time, the predispositions as per the genetics, so that they don't develop this in the future. So since this is a prognostic test, the solutions are also given on the basis of prevention. Okay, so here we talk about intolerances and food sensitivity. On the basis of this, what is their risk and what they need to do, so that they understand the key important points. Because in your genetic report सब कुछ दिया हुआ है, जहाँ पे risk है नहीं भी है, but here we only talk about where you have the risks, so you can just put on your blinkers and focus on these areas. Then you have medical monitoring. Now, why medical monitoring is given here is because on the basis of your genetic report, what you need to include in addition to, if you have certain health issues, let's say this patient has most of those health issues, right? They have hypertension, they have gallbladder related issues and GERD, etc. So wo tests to honge hi isme, but at the same time, the predispositions also are to be included, because this person may not be aware that currently, since they don't have a problem, that they may not get it in the future. So this is very important part. So monitoring is to be done every year. That's the blood test, the diagnostic test. Then you have recommended food supplements. Now the supplements are given on the basis of two things. Number one is if the person already has a health issue, it is mentioned here. At the same time, to prevent certain health issues based on the genetics, the supplements are also given. So in this case, we always put a disclaimer. You need to consult a physician before you take any kind of supplement. At the same time, just because it's given over here, do not blindly take it, because we've mentioned it here only if you have a deficiency. The reason for giving these supplements is because it has shown up in your genetic report, which means this report should last you for a lifetime. कि मतलब अगर आपको अभी deficiency नहीं है, but अगर 5 साल के बाद हो गया, so you can look back at this report and see what is it that you need to take, because you already knew it was in your genetics, right? So then you have fat, water, salt, and sugar intake. So here also, Mr. Abhijit, like he asked me about, the detox or the alkaline water. Here it's also mentioned water with a pH of 8.5 is known to have good benefits for your health, which is alkaline in nature. Anything above 7 is alkaline. 7 is your neutral pH. Below 7 is your acidic pH. Okay. Then you have salt intake on the basis of the person's genetics. Now, in this case, if the person has certain gallbladder issues, then over here we tend to change the kind of oils that are given, because it changes as per different health conditions. Then you have physical activity and exercise. What kind of exercise works for the client as per what the requirements are. Then you have personalized diet plan. Okay, wherein right from morning to evening the choices are given. The reason why so many choices are given is also because there shouldn't be a monotony. At the same time, the person should be able to get the benefits that they are looking for. And the dietary guidelines again is on the basis of the health conditions. Now in this case, the person has uric acid, so what they need to do is also included here. Then you have customized lifestyle modifications as per what their lifestyle changes need to be. Okay, so this is your sample action plan. Let's take questions. It's 11:30. We still have time. All right. So you all can ask questions. Anything, not just related to this particular chapter, but even if you all have any doubts that you all have so far, because now we have come to an end of your entire certificate course, and you'll be looking forward towards your convocation very soon. So if you all have any doubts right now, we can discuss it. Okay, let me just. Yes, sir. Go ahead. Yes, sir.
Hello.
Hi, sir.
Yeah. Good afternoon. I have a question. Now, since we finished
Good
this
afternoon.
course and all, uh,
Mhm.
uh, do we have a backup where you can go and revise this thing once again, or how does it go? If I
So
want to look into back.
okay, so it is actually not going to be there as in for a very long time. It is usually online because there's a lot of the course is actually made in such a way that it is very much in depth. So usually we do not give an access for many months after the course is over. So I think Stanza, can you just answer this question? I think Stanza is there, not there. Okay, no, he's not there. So usually we do not have an access to the course after, let's say, a month of completion, after completion of your course. So you will have to, go through it only during this particular time, which is why we give a certificate. It's a certification course, so it ends at that once you have received your certificate. Okay. Any other questions? Who else has raised hand? Once again, I'm not able to see. Okay. Yes, Abhijit sir. Once again.
You unmuted me.
Okay, so I think I unmuted Sumit sir. 1 second. Okay. Yeah, Abhijit sir. Go
Yeah,
ahead.
Rina, I just asked in the chat, does this genetic report tell us whether our body type prefers a vegetarian meal or a preferred non-vegetarian meal? So
No,
that,
sir, actually it does not. We don't have that kind of this one test. But yeah, I think this stems from mostly the Ayurvedic aspect where we talk about the Vata, Pitta, and the Kapha, where certain kinds of diet it does suit a person. But this is we are not actually checking a gene that talks about the preferences.
okay. One more thing is, how much does the genetic testing cost?
So the price and everything you will have to talk to your if you have any IBOs that are going to guide you through it. So they would be able to tell you currently what is the going rate.
So who can help us then?
There are numbers that you can call on. It's on the website, so you can directly talk to them.
Okay. And one last question, Reena, is can we make this nutrigenomic consulting a commercial activity and practice by having a clinic of ours?
No. So the certificate alone does not, provide you with that, possibility of consulting as a nutrigenomic counselor, but you are given a certificate as a nutrigenomic consultant where you can, guide people when it comes to their nutrigenomic the report and all of that. But it may not give you like a, it's not like a degree wherein you can say that you can have a clinic for this particular consultation. So
So
you
does
will
it
have to be in tie up with a particular genetic company wherein you can provide the services.
for the past 5 years, 5, 6 years since you have been in this field, Reena,
Mhm.
are there people who have started or gained some extra knowledge apart from Bignet and they've started their own clinics?
Um, Not that I'm aware of, though. Not that I'm aware of. So in some cases, we since you're already aware, there are certain doctors that have, they join us, MBBS doctors, they join us. They integrate that into their practice. So as far as nutritionists are concerned that have joined us, they might integrate that in their practice by getting their patients genetic report done. So as far as the other people are concerned, what they do is they do either they get their genetic report done for their patients or their clients or their friends or whoever, and they can explain it. But practicing as legally practicing as a counselor after the certificate course is not actually possible, because it's just 2-month certificate, na?
Then who can do it then?
You will have to have at least a 6-month diploma course for that, if in case you need to practice with a certification, a proper certification. So this gives you the the power to be a nutrigenomic consultant. You can consult as such, but there is no such post or a position that you can open a clinic with.
Okay, so if I'm not wrong, I think Stancer told about the symbiosis course at the beginning of this course, that
Okay.
that there are a lot of extra knowledge courses which are offered by Symbiosis Pune.
Okay.
Is it so?
There is a degree in nutrigenomics. You can look it up, and if in case I do have the information, I will definitely send it across.
Okay.
I don't know what exactly, which course was he talking about, but there is a degree course in nutrigenomics.
And how long does it last? Is it a 6-month course or a longer
No,
course?
I think it will be a longer one. It will be a year or 2.
Okay.
Well, let me just get all the correct information for you so that I can send it. Otherwise, I may not be giving you the right information.
Okay. Thank you, Rina.
Okay.
Thank you.
Okay. Yes, Mariama.
Yeah, Arena, I wanted to check with you, like, we have these notes which are so elaborate, and, after we complete the course, it would be not possible to retain all the knowledge that is there. So
Right.
in future, if we would like to refer to these notes, because they are very useful, a lot of useful information there, and, if we want to go back, can we have the printed copy of that, like, something to refer to?
Actually, ma'am, we have not been doing that, and it is completely decided by the management. And this is something that Stancer would be in a better position to actually decide. It's not on me actually. So I think if you all can probably ask him about it, that would be better.
So we can't take a printout of this?
No.
Sorry?
No, ma'am. Let me just see if Stancer can come online to answer this, because all of you have the same question. So just a minute. Let me just take other questions, and let me meanwhile just try and.
Yeah, thank you, Rina.
Yes, sir.
One question that I have in specific, besides, I also wanted to know that what are other resources wherein we can improve our knowledge further.
Sorry, your voice is a little, it's breaking. Hello?
Let me just change this.